A government senator is this evening raising an alarm about what she calls a major problem in the treatment of breast cancer in Jamaica.
Dr. Sapphire Longmore, herself battling the illness, says patients at one of the island's major hospitals are being blocked from accessing a critical drug to fight the disease. TVJ's Vashon Brown was in the Senate today.
I am very honored to be here this morning.
Government Senator Dr. Sapphire Longmore, who is battling breast cancer, making her contribution to the State of the Nation debate in the Upper House on Friday. In October last year, she stepped out of the shower and felt a lump in her breast. Doctors later confirmed that she had an aggressive form of breast cancer, which was moving fast. She explains that when someone has breast cancer, there are 3 possible immunotype markers.
It can be estrogen positive, can be progesterone positive, or it can be what we call HER2 positive. The worst scenario here is that you're triple negative. It means that the drugs that are developed cannot target. However, of the 3 types, the HER2 positive is the most aggressive, it is the most deadly if left untreated.
In her own journey, she says she's identified a disheartening problem in the treatment of breast cancer in Jamaica. She notes that there is a service that offers treatment for the most aggressive form of breast cancer at the Kingston Public Hospital, KPH, and the University Hospital of the West Indies, using money from the National Health Fund.
One of the drugs, Herceptin, is highly effective in treating this type of breast cancer.
She argues that the program with the NHF funding for the drug was developed to see to the treatment of at least 60 patients per year.
Mr. President, the sad reality is that persons who are registered to the university hospital are being blocked from accessing this drug. This is the reality. This policy has been in place from 2014. And as we speak, persons with HER2 positive carcinoma who are attending the university clinic are being told that they cannot access this drug through the NHF. They can access other NHF drugs, but not this drug.
Dr. Longmore says the patients are instead being directed to KPH.
Although UWI has been approved to treat early-stage breast cancer, since 2014, as I said before, no patients to date have been able to access the medication. This current state at UWI sends patients down there to go to a waiting list at least 3 months if you're fortunate. KPH is already burdened, and we are now adding to this burden. I came across this very specific situation because of my situation.
Vashon Brown, TVJ News.